Hello, this is Phelps with Refuge. Today we're going to be talking about triage codes, triage procedures, all these different aspects of it, both in a situation where we have extensive medical network to support us, as well as perhaps when that won't be around. So first off, what is triage? Triage really is just a way to quickly divide up a large number of casualties. If you come up on a situation, car accident, it's very likely, right? Or something of that nature where there's only one person injured or maybe two, you don't really have to be concerned with triage. Triage is for a vehicle exploded or building collapsed or something of that nature, and you have a large number of casualties, and you need to very efficiently manage the time spent rendering aid, the medical supplies, which may be limited and not able to address all of the casualties, things of that nature. Triage helps us determine in what order to do that. So we've covered the SMART-G algorithm. If you've taken any of our medical side classes, we cover that, and that is a prioritization of care for each individual. Triage can kind of be thought of as a prioritization of care for a large number of individuals. So we have these codes here. Now, a lot of different things talk about use the same colors, right? But for triage, what we're going to talk about is red, yellow or orange, green, and black, okay? And I have them here in priority, really. Up here we have urgent, okay? So these are the individuals who they need immediate care. So for this, I want you to think like arterial bleed that hasn't been stopped, right? Severe penetration of the chest cavity, things of that nature. Maybe a major bone broken that hasn't been treated. They're going to be your top priority. They need to be treated ideally, and again, this is guidelines, right? But they need immediate treatment in less than 2 hours, right? That's, you're trying to stop that bleed. You're trying to reestablish an airway or means of breathing, moving them onto that higher level of care in a very very quick manner. Priority would be the next stage. Some people use yellow, some people use orange, but this is really, so maybe they have an arterial bleed, but it's been treated with a tourniquet now, right? Maybe they self-applied a tourniquet. This is where you have very severe injuries, but it's not immediately life-threatening, needing immediate treatment. We're looking at that 2 to less than 4 hours to that higher level of care, okay? Now with all of this, you'll notice we're not talking about minutes, right? So the SMART-G algorithm, we talk about seconds count, right? Seconds matter. Well, with this, we are looking at not in a hot zone. This is tactical field care. So this is once you're removed from the building that fell in or where the bullets were flying, maybe. Beyond priority, we have routine. Now, this is commonly referred to as your walking wounded, right? And I'm going to come back to why we call them the walking wounded here in a moment. But these are your minor injuries, right? Small burns, maybe some lacerations, maybe broken smaller bones, maybe like a finger or a smaller bone break that's not as critical. These are your routine triage patients, and they have typically around 24 hours to get to that higher level of care, okay? Now down here we have black, expectant. Expectant of what? They're not expected to survive, meaning that regardless of whether there were all these other casualties or whether it was just them, they're not likely to survive. They would not have great odds even if there were no other casualties. They go into this expectant category, and the unfortunate reality of that is You are trying to apply the time, manpower, and medical supplies that you have, which all have limits. You're trying to use them in the most efficient way possible. And it is a lack of efficiency to try to spend time with a patient that is not likely to survive even if there weren't all of these other patients, right? That allows you to come treat a casualty that might have a better chance of survival. So that's expectant. With triage, we are doing this actively. So it's something you do when you arrive on scene, but it's also something that continues on throughout the process, because these casualties, maybe I've put 2 casualties in this category, 1 in this one, and I had 1 that was very minorly injured. We may treat one of these and now they go to orange, right? Maybe this first one that was in orange, their injuries, there's a complication there, and they escalate to red, right? Urgent priority. You'll see a lot of movement through there. Triage is something that's ongoing, okay? However, we're gonna first focus on the initial triage, assuming you just arrived to some sort of scene like that. We talk about the 5 S's, okay? And those are safety, right? Safety is always number 1. Then we're gonna look at this scene and we're gonna determine what happened here, right? And we call that the scene size up. Okay? Once you determine that it's safe to render aid and what has happened here, right? You're going to send for help, right? Pardon my writing there. Okay, and so I talk about this frequently in our Responder 1 class, where we want to call 911 at the first safe opportunity, and that's the same thing here. If you are looking for that 2-hour, that 4-hour window of getting them to a higher level of care, if you've never called for help, you're going to be waiting there a lot longer than 4 hours, okay? So as soon as you can, you're going to send for that help, and then you're going to set up this place where you're going to be maintaining the triage, right? So this is commonly called a CCP, right? And so that's under tactical field care. It's referred to as a casualty collection point. So maybe there was an explosion and these people were strewn all over a field. Well, you're going to put them all in one spot to be treated efficiently, right? So that's the casualty collection point. And you need to set that up. It's not typically sitting there waiting for you. And then it's an acronym because we got to start. All this prep, and this should happen quickly, right? Because then we have to start. And so, come on over here. Those are the 5 S's. So, we want a simple triage and rapid treatment. That's the principle of triage. It needs to be simple and it needs to be quick, right? Efficiency is what we're looking for here, right? So I'll have the 5 S's. You can back it up if you need it. One of the aspects with that would be considered when you're taking in your CCP. So let's say I set myself up here and people are bringing me casualties. They're coming in this way from the site of the incident. I would want to place my CCP, whatever this is, somewhere that it's not going to get confused with where they're handing out food and water or whatever, if it's natural disaster or something like that, and somewhere relatively close to where our medical support is going to come to, right? So if this is, it could be medical evacuation. It could be resupply of medical equipment. It could be any of those things, but we want to be relatively close to that. As we bring our casualties in, we would want to put as these casualties are coming up, I meant to come back to walking wounded. The walking wounded, a really good way to quickly assess that is at the site of your disaster, whatever form it took, just tell everyone, hey, if you can hear my voice, stand up and walk to me. Suddenly, you now have all these people walking up towards you, which are walking wounded. If they're able to extricate themselves from whatever the situation is, get up and walk towards you, you obviously have to look them over and make sure they don't have any obvious signs of injury, because that can happen. But typically, those are going to be relatively minor injuries if they're able to make their way to you. They're going to go to this furthest spot in the CCP, right? And that's going to be for a number of reasons, but basically, if they're able to walk, then keep them walking and move them back there. We want the closest up here to be our priority and urgent. So, excuse me, as you're coming through here, looking at different casualties, doing your triage, you're going to be quickly looking for breathing. Like, are they breathing? If they're not, check for a pulse real quick. If they don't have a pulse and they're not breathing, it's a good chance that they're expectant, right? Or they're already passed. Move on. See if there's another casualty you can help, right? Look for the casualties that have active bleeding going on uncontrolled, right? As they come in, you can designate however you want. There's a lot of setups like this, but we would set our urgent here and our priority here. Alternatively, maybe you have a big round area and you're bringing people in here. You can start urgent. Maybe you have some litters or cots, so you can start urgent over here. Send your routines back here. And for clarity, your expectants are going back with your routines. And that's because if you're moving them there at all, they'll be back with the routines, because this is the least amount of work that's going to be done in this area. Minor injuries, basically take care of yourself here perhaps. And then we'll put our priority over here. And this way we can start stacking litters or beds or whatever the case might be. Now, a lot of people ask us, but Phelps, there's no more electricity, EMP hit, or it's the great snowpocalypse of North Texas, or whatever the situation might be, where we don't have ambulance en route, we don't have care flight on its way, we don't have all of these mechanisms of the system and the grid that we currently rely on. Triage gets very tricky then. First off, you're having to deal with a mass casualty event in that setting. That is very unfortunate. It's not as likely either, because people are going to be in smaller groups most likely. But if you did, the other thing is you have to arrange this. You don't have 2 hours and 4 hours to a higher level of care. This essentially becomes a breakdown of what can you treat, right? So we have trauma, and then from trauma we have within the realm that you can treat, right? Maybe you have someone that can suture, maybe you have someone that knows how to set bones, something of that nature, and you have outside the range of treatment options you have available, right? And then we have medical, and this is the same way. On the medical side, you're governed by you're within and without treatment options as far as skill. But you also have in and out of scope of supplies, right? And so this could be Maybe you ran out of antibiotics and it's a medical issue that could have been treated, but you don't have the antibiotics for it. Or maybe it's radiation related and you don't have the necessary meds to handle that, or chemical, or perhaps it's just a wound that needs constant gauze added to it and redressed to maintain cleanliness, and you're running low on gauze, right? So maybe you can improvise something and overcome that. But this medical is a wider range, but it all breaks down to the same thing. Is it within your skill set and equipment set to be able to treat or not? And then our breakdown would be urgent. Urgent is traumatic, but within our realm to do something about. Expectant would be traumatic outside of the realm of something we can do something about, as well as both medical supplies or skill-based outside of what we have available, skills or supplies wise. Priority would be medical with skills or supplies that we can do something about. And realistically, in a grid down situation, if you are routine, get back to your life. You got other stuff going on. You're going to be staying busy. So that's kind of how it would break down theoretically in a grid down type setup like that, without any kind of outside influence like World Health Organization or Doctors Without Borders or something like that, some agency coming in and setting up a triage in an area that doesn't have the grid for some reason, but in a collapse type setup, this is more how I believe it would settle down to for triage. All right, so this is Refuge and I'm Phelps, Stalwart Peacekeeper Online, and thank you for tuning in. I hope that you learned a thing or two from this. Have a good one.